Hi class, our next disease of the nervous system is meningoencephalitis. So in other words, we have a swelling of both the meninges and the brain. This can be caused by two primary microorganisms, Naegleria fowleri and Acanthroamoeba. These are both accidental parasites that can invade the body, but typically this is only going to be under very unusual circumstances. If we look at this amoeba, Naegleria fowleri, it's reportedly going to infect people who have been swimming in warm, natural bodies of fresh water. This has been in the news recently. We are here in the state of Minnesota, and there have actually been a couple instances of this amoeba showing up in swimming pools and lakes within Minnesota. This pathogenesis and virulence factors of this amoeba are that this amoeba needs to be enforced into the human nasal passages as a result of swimming, diving, or other aquatic activities. The simple fix is to not roughhouse, or if you plan on roughhousing while you're in a stagnant pond or a slow-moving body of water, that you should wear nose plugs to keep that water from being forced into the nasal passageways. This amoeba can burrow into the nasal mucosa and then migrate into the brain and surrounding structures. This Naegleria fowleri is primarily going to cause amoebic meningoencephalitis, or PAM. This causes massive destruction of our brain cells and spinal tissues, and it almost always results in death. Before death, though, the patient will have cerebral hemorrhaging and fall into a coma. This amoeba has wide distribution in fresh bodies of water. It is all over the place, very common. Children are capable of carrying this amoeba as harmless biota, particularly during the warm summer months when they spend a lot of time in the watering hole, so to speak. It's found that there's a series of events that leads up to this infection that are very rare. Most individuals do not actually become infected by this microorganism, even though they're going to be carrying this microorganism as part of their normal biota. It's believed that once this microorganism starts to invade, it will advance very quickly. And because of its quick advance, treatment is usually futile. Early therapy with antiparasitic drugs like amphotericin B, sulfadiazine, or tetracycline in some combination can be of some benefit, but generally speaking, you give palliative care and hope for the best. Because of the wide distribution of this organism and its hardiness, there's no general means of control. There's no way to get it out of all the lakes and streams that are present in North America. Public swimming pools and baths that are adequately chlorinated can be periodically checked for the amoeba. Generally speaking, if the water is chlorinated, the amoeba cannot survive in the water. We also have meningoencephalitis and Acanthroamoeba. This causes another form of meningoencephalitis that's very similar to the Naegleria form. This course of infection is a little bit lengthier. It's not quite as rapid. It's been found that granulomatous amoeba meningoencephalitis, or GAM, is caused by this amoeba. It's transmitted by invading into our broken skin or through our conjunctiva and occasionally the lungs or urogenital epithelia. Individuals that have had traumatic eye injuries or potentially that are wearing contact lenses or are immunocompromised AIDS patients are also at risk. So we have our primary amoebic meningoencephalitis and our granulomatous amoebic meningoencephalitis. This one, the primary, kills you off very quickly. The granulomatous has a much slower rate of progression. Both of these are very serious diseases that are difficult to treat. Generally speaking, if you have the primary form, you are not going to make it. And if you have the granulomatous form, the surgical treatment or removal of the granulomas can be a prescribed option. We also have acute encephalitis, or acute swelling of the brain. Encephalitis is generically referred to as swelling of the brain, and we can have acute, or also known as severe, or subacute, or mild swelling of the brain. And any swelling of the brain, whether it's severe or mild, is always going to be serious. Our tissues of the brain are very sensitive and don't have a lot of room in our skull. So any kind of swelling is going to impair the function and potentially pinch off blood supply. Acute encephalitis is almost always caused by some kind of arbovirus, or virus that's carried by an insect. These include West Nile viruses, herpes virus, or any kind of bacteria that can cause encephalitis. Generally speaking, the symptoms are going to be more pronounced in the meninges if there's a bacterial cause, as opposed to a viral cause. Acute encephalitis can be caused, or will have some signs and symptoms associated with it. Notably, there'll be some behavior changes. As the patient's brain is swelling, some function becomes impaired, and the patient will have some confusion and behavioral changes. This will eventually progress to decreased consciousness and or seizures, and eventually will mirror a lot of the symptoms of meningitis. To treat acute encephalitis, we need to have some empiric treatment with aciclovir. In the case of a herpes-based encephalitis, the treatment doesn't do any harm to persons that are infected with other agents. So because this treatment can only help, it's generally given as a rule of thumb. These arthropod-based vectors, or arthroviruses, or arthobacterium, are going to feed on the blood of our hosts, or the hosts. These infections are typically going to be associated with climates and weather patterns that are favorable for the arthropods. So if we go into an area that has lots of mosquitoes, you're more likely to contract an arbo-based virus. So late spring to early fall are the times of year that we typically contract arboviruses. Warm-blooded vertebrates are going to need to maintain our virus slowly during the cold and dry seasons, and that virus will be maintained in the warm-blooded vertebrates as the reservoir host until we can get it back into the arthropod vectors in the late spring to early fall again. Human beings, generally speaking, are a dead end. When we get infected, we're an accidental host. An equine encephalitis, or a maintenance host, for example, if we have a yellow fever infection. These infections, generally speaking, are targeting other organisms, and it just so happens that we as human beings can get infected with them. These arboviruses have a dramatic impact on human beings. It's believed that millions of people are going to acquire an arbor-based infection every year, and that thousands of them are going to die. A very common outcome of an arbor-based infection is acute fever, so that very high fever that can often be accompanied by a rash. Some of the symptoms and managements of encephalitis that are caused by arboviruses are very similar to each other. The transmission and epidemiology of individual viruses are different, but the management of the symptoms are going to be similar regardless of the individual virus that's causing the disease. Pathogenesis and virulence factors of arboviruses are going to include being bit by a bug. So there's going to be some kind of an arthropod bite. And after being bit, the virus is going to be released into the host tissues. So the patient will be inoculated with the virus. And then that virus typically is going to replicate within our lymphatic tissues, within the lymphatic system itself. All arboviruses are capable of being transmitted by mosquitoes. There are some other arboviruses that can also be transmitted by other insects, but mosquitoes are capable of transmitting all arboviruses because they can move blood from one patient to another patient, and that blood can contain the virus. Prolonged viremia establishes the virus in the brain. So the longer that virus is in the host patient, the more likely that virus is to get into the brain. Once it gets into the brain, inflammation can occur, and that causes the brain to swell and be damaged, and the nerves and meninges along with the brain will swell and be damaged. Some of the signs and symptoms of an arbovirus-based infection include some variable symptoms. Depending on the patient and the specific disease, the symptoms are going to vary. But Generally speaking, those symptoms include coma, convulsions, paralysis, tremor, loss of coordination, memory defects, changes in speech and personality, and heart disorders. So depending on which virus is causing the infection and where that virus is becoming established in the brain, we're going to have different neurological symptoms manifest themselves in the patients. But despite this wide variety of symptoms, there's all nearly the same treatment option regardless of the virus type. In some cases, the survivors experience some permanent brain damage. Thankfully, that's the exception. Young children and elderly adults are very sensitive to injury by arboviral encephalitis. Thankfully, healthy adults with established immune systems are capable of fighting off the virus and are not as susceptible to arboviral encephalitis. If we look at the culture and diagnosis of these pathogens, it's very difficult to detect them. If the patient comes in to the clinic with a headache, a rash, and a fever, that's not necessarily very indicative of, oh, you must have an arbovirus. So the patient history needs to be taken into account. If the patient's been traveling to endemic areas, that could be a possible clue that, oh, maybe they contracted a disease from that endemic area. Serum analysis of the patient can be done to establish whether or not the virus is present in the blood serum or if the body is producing antibodies for the virus. Rapid serological tests are available for some of the specific viruses. To prevent and treat arbovirus-based infections, we're going to go with empiric acyclovir therapy, so there'll be an antiviral drug administered to treat this viral infection. The support measures are going to also help control the fever, convulsions, and dehydration and solve shock and edema, but those are more temporary or Band-Aid approaches. The main approach is to get that virus out of the body. There are some safeguards that are also aimed at arthropod vectors. Those include such things as mosquito netting, to name a few, or mosquito spray, or having screens on your porch, or having screens on your windows. Here are some examples of arboviruses. We have Western equine encephalitis, Eastern equine encephalitis, California encephalitis, St. Louis encephalitis, and West Nile encephalitis. So there's a bunch of different viruses that are associated with encephalitis or causing the brain to swell. And these viruses can all be transmitted by an insect vector. Another virus that can affect the nervous system is the herpes simplex virus. We have herpes simplex types 1 and 2. These viruses are capable of causing encephalitis in newborn children that are born to HSV positive mothers. This virus can be disseminated from mom to child, and if that happens, the prognosis, generally speaking, is going to be pretty poor for the child. Older children and young adults are also capable of incurring or developing encephalitis from humans herpes virus simplex HSV1. Encephalitis in these situations is going to represent a reactivation of the dormant herpes simplex virus from a trigeminal ganglion within the patient. The varicella zoster virus, the virus that's associated with chickenpox and with shingles, can also reactivate to form the dormant state, and can cause encephalitis in rare situations. We also have the JC virus. The JC virus is named after the very first patient that was diagnosed with this disease. Serological studies have indicated this infection is a polyoma virus and is very commonplace. It's associated with progressive multifocal leukoencephalopathy, PML, and is associated with patients that have immune dysfunction. This is one of those indicator diseases. If a patient comes in with the JC virus and an active infection from the JC virus, that's usually a big red flag that they are immunocompromised, generally speaking, from HIV/AIDS. It's uncommon that a patient has an active infection from the JC virus, but if they do develop that active infection, it is generally fatal. Results of the JC virus attacking the accessory brain cells and then demyelination of certain parts of the cerebrum are what lead to death. Very few deaths have been prevented with the treatment with zidovudine, but this is a medication that is not very effective. So we have acute encephalitis. Acute encephalitis can be caused by insect-based viruses, the herpes simplex viruses, or the JC virus. So, concept check. Which of the following would not be an arboviral, arbobacterial, or arboprotozoal vector? We have mosquitoes, fleas, raccoons, kissing/assassin bugs, or a tick. You can rewind the video, pause the PowerPoint, and check your textbook or your notes. Get me a correct answer. 1, 2, 3, 4, 5. All right, class. An arboviral, arbobacterial, arboprotozoal vector has arbor. All of these pathogens are transmitted via arthropods, or insects. And the only thing here that's not an insect is the raccoon. So that's the correct answer, raccoon. If you have any questions about these diseases of the nervous system, please feel free to post them on the discussion board or shoot me an email. Happy studies.